Hi everyone, we're just going to give it a couple of minutes for more people to join and then get started. Okay, welcome everyone. Welcome to this event, which is Zero COVID, an international movement. I'm Tazy, my pronouns are she, her. I'm part of the Zero COVID campaign. And the Zero COVID campaign is basically a campaign calling for an elimination or maximum suppression strategy to eliminate COVID. At the moment, the key things we're focusing on are the test and trace system, trying to kick Serco out of it and instead hand it to local public health teams, fighting for support for self-isolation and sick pay, and action on workplace safety. So the campaign is about driving cases down and preventing new outbreaks. At the moment, there's sort of a feeling in Britain that the pandemic is kind of over, but actually very recently, Boris Johnson said that there was going to be a third wave and he was not really going to take action to prevent that from happening. Meanwhile, across the world and across Europe, we're seeing that the pandemic is really far from over and there are sort of dangerous new variants emerging all the time. So this event is being held on Zoom. It's also being live streamed. If you're watching on a live stream, then feel free to join the Zoom so that you can participate more. So we've also got closed captioning. If that's not showing for you, then just click the live transcript button at the bottom, or you might find it under more or meeting settings. If you're finding them distracting, you can also switch them off in the same places. We also have a full transcript option via Otter, which you can access via the live button, and that one is more accurate. In order to follow the meeting more easily, you might want to switch from grid view to speaker view. So in the top right corner, there's a little button that says view. And if you just click that, you can switch from grid to speaker, and then it will just show you the person who's speaking at the time. The Zoom chat is not open to participants. That's because we don't want to have it sort of being overload. And so instead, there is a document where you can, which you can use for chat and discussion, and have that open on a separate tab. At the moment, everyone is muted. If you are called to speak, then the host will unmute you and you'll then be able to speak. So in this session, the structure is that we'll first hear from 3 of our speakers, and then we'll have time for questions and short contributions. And then we have a 4th speaker after that, and the panel will come back after the questions. So now I'm going to introduce our first speaker, who is Christian Zella. Christian is an activist with Zero COVID in Germany and is the co-author with Winifred Wolf of Corona Crisis Capital, Plea for an Alternative in Solidarity in the Times of the Pandemic. Christian, over to you.
Okay. Hello, everybody. Thank you very much for the invitation. I think it's a very important event you organize, and I think it's very important to engage in shared learning processes for developing really common strategies against the pandemic and the eco-social restructuring lately of the entire economy. So I will focus my introduction on 4 or 5 points. I start with just a short description of the situation in the three German-speaking countries, Germany, Austria, and Switzerland, and then I will go on to some more broader questions. So the three German-speaking countries managed the first wave of the pandemic comparatively well. All three governments acted considerably late, but comparatively decisively. After initially considering herd immunity as a strategy, they switched quite quickly to the flatten the curve strategy in mid-March 2020. In this logic, they already withdrew important measures in May and failed, but that then failed to eradicate the spread of the virus during the summer, which would have been possible. The second and the third pandemic waves were politically produced at the end. In the autumn, as well as in the past weeks and months, all three governments deliberately did not break the contagion of the virus because they clearly prioritized immediate economic interests. For instance, in Austria, the government also adapted its strategy to the interest of the tourism industry in winter. However, they failed precisely because of their ignorance of the dynamics of the pandemic. In Switzerland, liberal economic ideas have prevailed for decades. So therefore, it's not surprising that during the second wave and now the third wave of the pandemic, the death toll in Switzerland is much higher than in most other European countries. So the third pandemic wave now has been underway for weeks, and for the third time, hospitals are exceeding their capacities in Germany and some cities, and in Vienna and Austria, and for the third time, several hundred people are dying every day again, which could have been easily prevented. However, now the strategies of the three countries start to differ in a certain sense. Austria and Switzerland continue their liberal perspective, the liberal strategy. However, in Germany, over the last few weeks, and now just recently, the government, in agreement with the large groups of capital and under popular pressure, started to change its infection law and tries to bring down the infection speed, the contagion of the pandemic again. So, however, this law is still in continuity with the flatten of curve strategy. So the measures restrict people, population in their free time and their private sphere, but businesses, however, are not held accountable. So they are not even subjected to an obligation to test their employees in a regular way, so twice a week or so. Even that they restricted to integrate into the law. So the second point is, of course, all three countries, as well as all other governments in Europe, focused or prioritized the interests of capital. At the beginning of the pandemic, the governments decided not to fight the contagion decisively, but only to keep them on a certain level. The government's flatten the curve strategy was set to put the contagions on a certain level, like the temperature of an oven. Of course, this didn't work. And the level was supposed to be at that point that the health system would not collapse under the burden of the care work. So the flatten the curve strategy aims at minimizing the impact on capital accumulation, that is the circulation of capital and of course the production of surplus value through labor. However, finally, the government strategy only fails when people begin to fight against this strategy at the end. So it's not a technical curve, basically it's a political curve. It's just dependent on the political power relations. But because now to the situation of the left. because the left, the broader left, did not propose a clear strategy in neither of the three countries to fight the pandemic. And that's one of the reasons right-wing corona deniers temporarily gained prominence. Unfortunately, only a few left currents recognized the global and comprehensive social dimension of the pandemic from the beginning and argued for really fighting the pandemic clearly. It took, for instance, the German broad left party almost a year until December 2020 to come out clearly for the first time in favor of measures to reduce contagions. Until then, the entire spring and summer and autumn, the left party limited itself to calling for measures that would socially caution the suffering of the people by the pandemic and demanded for all kinds of economic compensations. But they did not demand for radical fight of the spread of the virus. Fortunately, now they changed over the last few months. They started to change its behavior, and now they adopted more or less a relatively correct strategy and really call for a radical low incidence strategy. But I think this is one of the reasons, this failure of the left, that right-wing currents could fill the vacuum, could fill the gap over the summer and fall, autumn to spring, yes, to gain importance. One of the the fourth point is one of the weaknesses of our strategy, I think in all German-speaking countries, probably also in other countries, is that neither the trade unions nor the political left really have been able to act against the pandemic. The trade unions remained largely inactive. In many cases, they even cover for the management which opposes against masks and compulsory testing till today. For fear of losing their jobs, they completely subordinate themselves to the dogma of competitiveness and thus render themselves unable of acting. Actually, the health of workers and their families should be a central trade union concern. Occupational health is also a fundamental ecological concern. So the trade unions could do a lot to protect workers. They would be able to gather valuable information about what is happening with the infection on workplaces. They could enforce measures or even organize strikes to protect workers and their families. Unfortunately, in this respect, trade unions are not fulfilling their most fundamental core task. This raises the question of how we can anchor an emancipatory health policy in society. I think that's probably a problem you also face in other countries. So in this situation, in January, we launched our Zero COVID campaign in Germany, Austria, and Switzerland. And surprisingly, our appeal we started on mid-January has been signed in a very few days by several tens of thousands of people. So this appeal now has more than 112,000 signatures. Zero COVID representatives were invited to major media. And for the first time since the beginning of the pandemic in January, February, it was possible to shift the broader discourse towards a really strong, radical strategy of fighting the pandemic in a solidarity perspective. Since then, at least to a certain extent, workplaces have also come increasingly to the focus of the public debate. And we also published two mass newspapers to address people directly. And fortunately, the Zero COVID campaign has been successful in a certain way to influence the left party's positioning process. After many controversial discussions, the left party now clearly is in favor of, as I told you already, of a low incidence strategy. So I come to the last point, to the fifth point. The way the governments behave now in Europe, the pandemic will go on many months or even longer. It will kill tens of thousands of people more in Europe and millions in the world, I think. Hopes are now pinned on the vaccines, but the vaccination campaigns alone will not end the pandemic, as you also have discussed in your countries. Experts warned on this from the beginning of the pandemic, and this is now tragically confirmed. There are three reasons. First, the virus is mutating. Second, vaccinations campaigns are too slow to really stop the third wave in many countries in Europe. And third, there are simply too few vaccines worldwide. We always have to consider the pandemic on a global scale. So this also requires an abolishment of intellectual property monopolies and a solidarity-based technology transfer. So as governments continue to endanger people, it is necessary to build a strong movement from below so that people can collectively protect themselves and enforce a solidarity-based fight and strategy against the pandemic. It is obvious that the pandemic can only be defeated on a global scale and also in a global solidarity way. As long as not everyone is protected, no one is protected. I'm glad that Zero COVID UK is organizing this event. It is enormously important that we learn from each other and exchange experiences, and also consider to get together how we can anchor a necessary perspective of radical fight against the pandemic in a socialist, in a feminist and ecological organizations, in trade unions and in the entire population. So we should also consider developing a common platform, probably, of demands and common perspectives for action on certain issues. So I raise three questions. Which demands can help us to enforce a radical reduction of contagions on workplaces and within also international value chains? How do we achieve vaccine justice, both in our societies and of course on a global scale? And how do we concretely oppose vaccine nationalism? I think that's a major issue. How do we link the fight against the pandemic with our concerns for the solidarity and ecological restructuring of the entire society? And what strategies can we use to avoid the risk of zoonosis? So finally, how do we generally move from a defensive to an offensive strategy? How do we succeed in developing demands that are understood by the broad population and large sections of the population and the working class, and allow concrete perspectives for action to improve the balance of power, the relationship of power, and at the same time point to the perspective of a comprehensive eco-socialist restructuring of the entire society? So thank you very much.
Thanks so much for that. Our next speaker is Aoife Mcleisert. Aoife is a professor in the Molecular Evolution Laboratory of the Smurfit Institute of Genetics at the University of Dublin in Ireland. And she is also a member of the Independent Scientific Advocacy Group, which is sort of Ireland's independent SAGE. So Aoife, are you?
Yes, I'm here.
Great.
Thank you. Thanks very much. Thanks for the invitation and the introduction. And yes, so the Independent Scientific Advocacy Group, we definitely modeled ourselves on Indie SAGE, and we share at least one member because Gabriel Scally is a public health, very well known in Ireland, public health doctor, works in the UK, and he's a member of both groups. So like Christian, I'll give a little bit of a history of what's happened in Ireland for the last year, because I think the situation in each country is slightly different, and the situation in our country has really been very much linked with how we've been dealing with it and how we've been responding to it. So Ireland, our government on the face of it reacted quite promptly and quite decisively, it would appear, to the first wave. So we had a full national lockdown quite quickly with everybody was supposed to be working from home except a small list of essential workers, and the schools were closed. And that happened relatively quickly. I think one reason why it happened relatively quickly in Ireland is because our government has also under-resourced our health system a bit worse than other European countries. So when they were doing that calculation of what can the health system tolerate, which I think it's a pretty brutal calculation to be done. It is essentially calculating an acceptable level of death. But when that equivalent was done here, the level was quite low in terms of what could be tolerated. But in any case, it looked like a very pretty prompt and decisive action, and there was huge solidarity in Ireland for this. So you didn't easily hear a dissenting voice, very, very little dissent. There was huge solidarity, and there was very much a spirit of we're all in this together. And the first lockdown was extremely effective. And in fact, we now know in retrospect that we did eliminate COVID from the island, and then we promptly reintroduced it. So, and we know this from genomic analysis. So when you talk about looking at the variants, you're sequencing the RNA, like the DNA equivalent of this virus, and you can look at that and you can compare it, and you can do that analysis essentially the same as the way you can do it for humans or any other species. You can see relationships by looking at the sequences. And that's how the virus is categorized into different variants. They're grouping the relationships into little families, and they give them these names like B and P and numbers and things. And when we looked at this in Ireland, when this analysis was done at the end of 2020, with samples that had been taken from our first wave and our second wave, it was clear that we eliminated our first wave. All of those variants had been completely eliminated from the country. And our second wave was largely driven by a single variant, which was first identified in Spain and then spread throughout Europe. So it was essentially summer holidays. So our first lockdown worked, and we squandered it. We had a beautiful opportunity to eliminate it from the island, and we wasted it. Not only that, there's been a huge amount of death since that point as well. So we know that in Ireland, we have a national public health emergency team, which was formulated for this crisis. It's not a standing committee, it's a collection of different scientists and public health doctors. And we know that they requested that our government introduce mandatory hotel quarantine in a letter in May last year. And had they done that, we would now be talking to you and telling you how nice it is in Ireland that everything is open and that we are enjoying a good quality of life, with the only inconvenience, not an insignificant one, but the inconvenience being that international travel is hindered, is slowed down essentially by this quarantine system. Instead, what's happened is that we are currently in the longest lockdown that any country has had, as far as I know, because we have been in lockdown since December. Because what happened was we had our second wave. So the schools went back last September as normal. And as everybody is getting to learn what exponential growth looks like. And exponential growth looks really innocent at the beginning. And so we were in a period of exponential growth, but it was not recognized by the government or anybody who's not used to thinking about it. And so I sometimes, when explaining what exponential growth looks like and how innocuous it looks at the beginning, sometimes give the example of this old fable where there's a master craftsman has made this chessboard for a big prince or whoever it was they made the chessboard for. And when they're discussing the price for the chessboard, the craftsman says, well, if you put 1 grain of rice on the first square, 2 on the second, 4 on the third, etc., I'll take the rice from the last square. And the prince thinks he's met a fool and readily agrees. And then they realize that the amount of rice on the last square is something like 10 years of global production. And so it looks innocent at the beginning. It's 1, it's only 2, it's only 4, it's only 8, it's only 16, it's only 32. And then it's not long until you're in thousands. So we were in exponential growth. It wasn't recognized. And eventually we passed a threshold which became intolerable. And we went into a lockdown again last, I think it was October. or thereabouts. Then there was pressure to open up for Christmas, because there was pressure. I mean, there was pressure from a lot of angles. People were tired of lockdown, of course. People wanted to be able to go to the shops and the restaurants and things like that. And at that point, our shops were only click and collect. So the group that I'm in, this independent scientific advocacy group, we were making ourselves very unpopular by saying we shouldn't open hospitality and we shouldn't open retail on a normal walk-in basis. It should stay as click and collect. And the government insisted that we needed a meaningful Christmas. And they also admitted that there would be an increase in cases by opening these things up, but they felt it was going to be containable. So they had not yet understood, the same as Christian said, that the governments aren't really understanding, and the mistakes they've made have been a lack of understanding. And so we opened for 3 weeks and the cases went so bad. We were actually, at the time of our opening, we were the best in Europe, which is a bit of a faint compliment, because it's like being the best in Division 3 in football or something like that, because Europe was the worst in the world. So being the best in Europe wasn't exactly a great accolade, but we were at that time the best in Europe. And a few weeks later, we were the worst in the world. That's how quickly it went wrong. So for the sake of 3 weeks opening in December, so we opened at the beginning of December, we have been in lockdown essentially ever since. The schools closed on the 22nd of December, as was scheduled for a Christmas break, and they only went back on the 12th of April in full. The schools were closed through all that period, and there's a work from home, and we're still in officially our highest level of lockdown. So this hasn't been understood. There's been a big gap in understanding. We've also had more deaths since Christmas than in the whole of the year. In the pandemic, we had 2 deaths. We had a number of deaths doubled in the month of January. So we had approximately 2,000 deaths in 2020, and we had another 2,000 deaths in January. So that's how badly wrong it went. So our group has been advocating for an elimination strategy because it's the only stable point on that curve of exponential growth. Any other point is going to quickly go up. So the group is made up of public health doctors, epidemiologists, data analysts, and various kinds. And we also saw there was actually a huge, in January, when everything went so badly wrong in Ireland, there was a huge push of support from the public. So there was huge support for mandatory hotel quarantine. There was huge support for essentially a zero COVID strategy. And people were looking for ways to get involved. And we formed essentially a people's campaign that's called We Can Be Zero. And it's at wecanbezero.com if you're interested. And we have local branches in local areas where they're trying to advocate and organize in their areas as well. And so that's been, that has had a lot of support. More recently in Ireland, we have introduced mandatory hotel quarantine, but only for a short list of countries. So, and that is, of course, not very sensible, because even, we know these variants, it is for the purpose, the government's stated purpose is to keep out the variants, because they believe that threatens the vaccination program. But they put countries onto that list after they notice there's a problem there. And just as I finish up, I'll just say, we know how much this virus spreads internationally. We know it originated on one point in the globe and very, very quickly was everywhere. And we see that also with the variants. So if we talk about the P1 variant that was first identified in Brazil, that was identified in the city of Manaus in the Amazon, which I'm not an expert on Brazil, but I've been told it's not a terribly well-connected city, yet from a not terribly well-connected city, it has now gone globally. So even if it's a city that's not a big metropolis with lots and lots of international flights and lots of international business travelers, it still gets everywhere. So you can't just think it's only in Brazil, or that the South African variant is only in South Africa. So and I think the thing that I think is really good today, and I think I would like to push for, is that a coordinated European approach would be really, really valuable. That if Europe could lead locally, I mean, we have great examples in Australia and New Zealand. We have great example in Taiwan and Singapore. But anytime you mention those countries, people will find reasons to say they're different, as if any one country is a replica of any other. But I think to convince Europe, we need some European examples. And I think some coordination in Europe would be really, really powerful. It'd be very effective. And it would be great to see that. Thank you.
Thanks so much. Our next speaker is Jackie Davis. Jackie is a founding member of Keep Our NHS Public and a panel member of the People's COVID Inquiry, and also a co-author of NHS SOS and NHS for Sale.
Can you hear me?
Yes.
Yes, thank you. First of all, thanks for inviting me today, and I'm speaking on behalf of the Keep Our NHS Public campaign. And I was asked to address two things. One is what our campaign is doing, and the other one was a question of social murder, which appeared in the British Medical Journal at the beginning of this year. So I'm going to start with two quotes. First of all, Boris Johnson, who said in January this year, "We truly did everything we could and continue to do everything we can to minimize loss of life and suffering." And in February this year, in the British Medical Journal, Kamran Abbasi, one of the editors, wrote in an editorial, "At the very least, the government's response to COVID-19 might be classified as social murder." So when Kamran Abbasi wrote those words in February, just 5 nations were responsible for over half the COVID deaths in the world. The UK, with over 100,000 deaths then, more now obviously, was one of them. And Abbasi asked whether allowing tens of thousands of deaths in pursuit of herd immunity or in the hope of propping up the economy is not premeditated and reckless indifference to human life. If poor decisions, including delayed lockdowns, opening up for Christmas, lead to excess deaths, who is responsible? And who is to blame when politicians ignore scientific advice, their own pandemic planning, international warnings, and history itself? He argues that the reckless behaviour of this government has led to thousands of unnecessary deaths, and should they be classified as murder? I'm going to talk a bit about our campaign and what we've been doing. We started our campaign, Keep Our NHS Public, in 2005 under a Labour government because we were alarmed at what was happening to the NHS under Tony Blair. And we've never been able to stop campaigning since then, sadly, because the threat of privatisation was joined by the devastation caused by Lancashire Health and Social Care Act, the imposition of austerity on public services, resulting cuts and closures and staff shortages. And all of those became important when faced with a pandemic. The NHS is never safe from politicians, but 10 years of Tory misrule have been devastating. It became clear early on in the pandemic that the government did not have a grip on events. They dithered, they delayed, they put off the lockdown until the 20th of March so that the Cheltenham Racing Festival could take place. It's no coincidence, of course, that Matt Hancock, our Secretary of State for Health, is MP for Newmarket and is close to the racing community. What's very worrying is that Boris Johnson, our Prime Minister, was just AWOL, absent without leave, for weeks during the crucial period. He missed the first 5 Cobra meetings, something which is unknown in previous decades in this country, because, of course, he was busy finalising his divorce, and he was finishing a book for which he had received £500,000 advance. You might say, what's the importance of that? Well, he was given £500,000 in advance to finish a book by April last year. And if he didn't finish it, he had to pay it back. So he hunkered down to get it finished during the critical weeks when he should have been paying attention to the concerns being expressed about the pandemic, when he should have been chairing those Cobra meetings. And one might conclude that he was guilty of criminal negligence. When it became apparent the UK was outstanding only in the number of deaths we were recording, people began calling for a public inquiry. And Johnson said, now is not the time, which of course begs the question, if not now, then when? He promised an inquiry at some time in the future, but we personally are not holding our breath. And meanwhile, we are missing opportunities to learn lessons from the disaster that's going on. And meanwhile, history is being rewritten by this government. For instance, we recently heard Matt Hancock saying there was never a shortage of PPE. I say, try telling that to the frontline workers who had none and were improvising with bin bags and dying as a result. So it's very important we capture what's going on. And we decided to set up our own inquiry, the People's COVID Inquiry, which is now underway. It's a 2-hourly online session every fortnight dedicated to a different aspect of the government's handling of the pandemic. The sessions are conducted by Michael Mansfield QC, and it consists of evidence from a mixture of experts and frontline workers and patients. So we've heard, for example, from Professor Sir Michael Marmot, famous for his work on social determinants of health, Professor David King, who set up Independent SAGE, Gabriel Scully, who my colleague mentioned just now, Bereaved Families for Justice. So far, we're the only inquiry of any kind looking into the government's response to the pandemic, and people have quite frankly been queuing up to give evidence because they know that the government will never allow such an inquiry because the outcome would be too embarrassing for them. I haven't got nearly enough time to go into everything we've heard. It's been so shocking, but I'm just going to run through the first 4 sessions very quickly. The first session, how well prepared was the NHS? Of course, not well at all. And let's not blame the NHS here. Let's be very clear. It's the people who run the NHS. So the NHS has done absolutely brilliantly. The government's in charge of the NHS. They ignored their own exercise, the Signat's exercise on pandemic preparedness, which showed we didn't have enough anything, including PPE, protective personal equipment and ventilators. The NHS went into the pandemic 100,000 staff short and 120,000 short of care staff. The government didn't only run down staffing numbers, but beds, in particular ITU beds. They sprang into action, of course, spending millions on Nightingale hospitals to accommodate the anticipated patients, but couldn't use them because they forgot that hospitals are not just buildings, they are the staff who work in them, in particular highly trained ITU staff, and those hospitals have become an expensive white elephant. Our second session was, how did the government respond? I guess it could be summed up as slowly and inconsistently. We know they were too slow to lock down. Confusing advice was a huge issue. For instance, advice around PPE changed over 40 times to fit the PPE that was available or more likely was not available. Patients were told to contact NHS 111 rather than their GP, and we heard from a GP that people actually died at home without ever seeing a doctor. How shocking is that? Elderly people were discharged from hospital to free up beds and sent back to care homes without being tested. Far from Hancock's boast about putting a ring around care homes, they sent elderly patients with COVID back into an environment full of vulnerable people and staff with no PPE. Our third session was, did they adopt the right strategy? And there was an initial talk, as other people have mentioned, of herd immunity. The advice from the WHO was very clear on basic public health measures. Test, trace, and isolate was at the heart of successful containment of the virus in other countries. And as I'm sure you know, it's been an absolute shambles in the UK. Instead of using over 40 public health labs around the country and local communities to run test and trace, the government brought in the private sector, including Serco, and centralised the process. Their much vaunted phone app never worked. 750,000 people who volunteered to help and who could have run local test and trace schemes were never even contacted. And contrast that with the successful vaccine rollout after the NHS was brought in. During that session, we heard from a leading public health expert in New Zealand how they managed. They looked at successes in other countries, in particular Southeast Asian countries who had experience with SARS, and they copied them. They had a tight early initial lockdown, a vigorous test and trace program, control of local outbreaks, meant that they have lived in essentially a zero COVID life for the last year with little or no ill effects on education or their economy. The last session we did was the effect on frontline workers. They felt safe, they felt unsupported, lack of PPE, lack of testing, lack of financial support for low-wage frontline workers, of which there are many in the National Health Service. Many felt they could not afford to self-isolate. There was moral injury, which is a huge subject, an important subject, and I think it will come out more and more, not being able to deliver a safe service and feeling under terrible stress, and thousands of people now planning to leave. Meanwhile, because of the staff and bed shortages, thousands of non-COVID patients were dying at home or seeing treatable illnesses become untreatable. One tube driver giving witness talked about their struggle to create a safe working environment for themselves, and they said the government was trying to do this on a wing and a prayer. We were doing the praying while they were winging it. I haven't got time to go into most of the evidence we've heard, including the failure to protect BAME workers when it became apparent they were particularly at risk. But the combined weight of these testimonies, given while memories are fresh, is absolutely damning. Perhaps the most damning of all was a statement from one of our expert witnesses that tens of thousands of lives have been lost unnecessarily. Think about that. It's 2 jumbo jets coming down every day during the pandemic. What a scandal that would have been if it had happened outside this pandemic. So the answer to the original question you asked me was this social murder? Has to be yes. Tens of thousands have died unnecessarily due to government negligence and mismanagement. We have heard from expert witnesses in our inquiry that it's not too late to change strategy. So one challenge is how to make them change strategy. The other question for us all to answer is, how do we hold them to account for this crime against humanity? And how do we build, as my colleagues have said, a better society afterwards? Thank you.
Thanks so much, Jackie. So we're changing the running order slightly. We're going to go straight to, oh, Fred, yes, what's up? no, okay. We're going to go straight to Mike Downham, who we were going to take after the questions. So Mike Downham is a retired paediatrician with an interest in respiratory virus infections and is in the organising group for the Zero COVID Scotland campaign, who have also just had their own public hearing events. So Mike, are you able to come in now?
Yeah, thank you very much,
Great.
Daisy, and thank you all for this opportunity. I've just come out of an event organised by Zero COVID Scotland, and it's a great opportunity to be able to share that with you. With all humility, this is a small, if you like, case study of what Scotland's trying to do, and particularly in relation to politicians. So we decided to set this up as a public hearing, and I'll explain what we mean by that as we go along. A public hearing for a Zero COVID Scotland, and as I say, we've just had a couple of hours of that now. So I thought I'd first of all tell you a little bit about how we organised this and the structure of the hearing, and then I thought I would just tell you. I had the privilege of being the last speaker, and I thought I would give you the way I ended my witness statement, and then finish by just telling you the final reactions of the 4 politicians we had there. So. So we had this opportunity of a parliamentary elections in Scotland, as most of you will know, on the 6th of May. And our campaign, our Zero COVID Scotland campaign, arose out of this UK campaign, which is where we learnt what we needed to do in Scotland, and for which we remain extremely grateful for the initiatives of the UK campaign. So this was in no way trying to be some sort of rival or different group. It's just that we had a different political situation, difficult political opportunity, which we thought we wanted to grasp. We had rather little time because we only got together about 6 weeks before we judged that the last moment would be available to try and influence candidates in the parliamentary elections, and it was a lot of work for only really about 7 activists. Most of the work involved persuading election candidates from the 5 main parties to join the hearing. We think there were 2 reasons for this. First of all, the usual format of hustings, as you're probably familiar with, gives the candidates the questions in advance. We were asking them to think on their feet, reacting to 5 witness statements given initially. And the second reason we think it was difficult is that just when the electorate has been encouraged to focus on recovery and celebration even, this was not something that I think politicians felt very comfortable about getting involved in a step change in how to manage the epidemic. We set ourselves. We aim to get a representative from each of the 5 main parties, and this got more and more difficult. And we set ourselves a threshold of 3. We thought that if we had 3, we could go ahead, and we set ourselves Thursday night, 48 hours, less than 48 hours before the event, to either cancel or go ahead. So it was a bit of a cliffhanger. We were on the point of cancelling when we got our 3rd representative on Thursday. This morning, a 4th candidate, a Tory, limped onto the panel, and I have to say the Lib Dems offered us instead of a representative a message to read, which was really a party political broadcast, which we declined, not very politely. So the 5 witnesses spoke for 5 minutes each as a block. 2 of us spoke about different aspects of the Zero COVID strategy, and one spoke about. Well, one was due to speak, and I think this is quite significant. Really, we know an extremely good speaker who is in an organisation for migrants and asylum seekers in Scotland, but unfortunately she failed to suss the technology. And although she's done it before, we'll try and find out what happened. But she didn't. She wasn't. We know she was trying to get in, but she couldn't. We tried to cover that in other ways, but that was a pity. But then we had a speaker that you'll know, I think, from PCS, talking about the abject failure of health and safety in workplaces, and we had a witness talking about long COVID very effectively, so we had 4 witnesses in the end. And the 4 witnesses were given, and then after that, the witnesses having just had 5 minutes, the politicians were given about 4 minutes to speak about each of the witness statements in rotation. So we had four politicians given about 4 minutes to speak about the witness statements, to react to the witness statements. I think this format is important because, as you'll know, the usual hustings format gives politicians all the control, and this format turns that on its head. We had a small turnout, but we were kind of expecting that because there'd been so much hesitancy up to the last minute that we weren't so surprised. The event's been recorded, and when you hear one of the final conclusions of the politicians was, I think the event has yet the possibility of having increasing influence. So that's just how we organised, and then I thought I would just read to you. Excuse me for doing this, but I really haven't had time to prepare for anything else. The last part of my statement, which was the last one. But what most of all concerns me is the talk of getting back to normal by the summer. When asked this week whether he thought there would be a third wave, Dinan Pillay, Professor of Virology at University College London and a prominent member of the Independent SAGE Committee, predicted that without a change in strategy by the governments across Britain, many of us might indeed get back to a so-called normal life again. But he was clear that there would be a large number of people for whom life would be even more restricted and devastating as new waves of infection hit them. The many people who are less well off, who depend on bad jobs and bad benefits, who have physical vulnerabilities, including long COVID, those who live in overcrowded, poorly ventilated homes, and those who have not been vaccinated, often because they don't have the best access to the best information. And I confess, personally, that the prospect of a still more unfair and divided society keeps me awake at night. And so then I said, and yet another far better future is entirely possible for all of us. I mean, this is just the way that we, as a team, and there was a lot of discussion about how to put this, that we as a team pitched the zero COVID message. So a far better future is entirely possible for all of us, and it's simple. There's a tried and tested method for eliminating viral and bacterial epidemics, which in this pandemic has been catchily but somewhat misleadingly named zero COVID, and which has been successfully used by other countries, including the Atlantic provinces of Canada, Iceland, New Zealand, Australia, Taiwan, and Vietnam. And the method consists of 5 things. First, and here again, this is the way that we've thought through these, the way we put these 5 principles of zero COVID. First, comprehensive restrictions, no half measures, in zones where case levels are high until case levels have been brought down to a safe level. Zones which have achieved low levels of infection coming together as bubbles. Second, workplaces, each of which has been made safe for workers and users before opening, and schools, colleges, universities, and public transport are all workplaces. Third, a find, test, trace, isolate, and support system entirely within the public health service, with the capacity to act quickly and comprehensively enough to stamp out new outbreaks. Fourth, support, financial, practical, and emotional, for each person asked to self-isolate according to their needs. Fifth, prevention of new cases and new variants from being imported across the boundaries between red zones and green zones, as outlined by Professor Watterson, who spoke first, majoring on borders. And I'll come back to borders in a minute. And then I said, finally, a word about vaccines. People have been encouraged to think that we'll be safe now we have the vaccines. But for 3 reasons, this just isn't true. The vaccines are really important because in most people, they will thankfully reduce the severity of COVID illness. But they are very much less effective in preventing spread of infection. The second limitation of vaccines is that sooner or later, variants resistant to them will emerge unless we at the same time use the other ways we know about to reduce levels of infection. Third, there are many people who can't be vaccinated, including children and people with weakened immune systems, and there are the people who choose not to be vaccinated. And to date, only 15% of people in Scotland have been fully vaccinated, that is, had 2 doses. Vaccines are not a replacement for a comprehensive public health approach to the epidemic, but if they are used in conjunction with the other 5 public health measures of the Zero COVID strategy, they can make a highly significant contribution. At a global level, Scotland must stand up for vaccines for all. It's true that no one is safe until everyone is safe. And then we were asked to end with a simple question to put to the politicians, which we thought it was feasible for them to sign up to. So my parting question to the 3 candidates was, if you are elected to become a member of the Scottish Parliament on the 6th of May, will you take every opportunity to argue that we need to vaccinate while we eliminate? Well, then, if I just very briefly, I just wanted to say that we had what I thought was an extremely interesting discussion on all the on all the witness statements by for the 4 candidates for the parliamentary elections. That was the last question. That is, vaccinate while we eliminate. And these were the 4 politicians' responses to that.
Mike, sorry, can I ask you to maybe wrap up within the minute? Thanks.
Yeah, I think so. One said, well, we've got to open up, but we've got to be cautious. I won't name the political parties of these, you can guess. Another said, if the global south isn't helped to catch up with vaccination, we've had it. A third said that he will, if he's elected, he will make sure that this same event, this same public hearing is held within the Scottish Parliament. And the fourth said that Scotland can play an important part globally by, in its small way, by showing what can be done. So I know we've got a challenge. I think the biggest challenge is the borders, but we're working actively on that with a number of global experts. And so that's where we are. Thank you very much.
Thanks, Mike. So we are now going to be, that was it for the speakers. So we now have lots of time for questions and discussion. Ian is about to end the live stream to social media. So don't worry, you could take part without that being streamed onto different platforms. So the way we're going to do it is by using the raise hand function. So that will be either, depending on which version you have, of Zoom you have, it will either be under participants and there will be a